This is articulated hand, and all these are carpal bones. There are 8 carpal bones. There are 5 metacarpal bones, 1, 2, 3, 4, 5, and they are all phalanges. In the thumb there are 2 phalanges, and other fingers there are 3 phalanges, proximal, middle and distal. So, you just try to identify the carpal bones. This is the palmar aspect of the articulated hand. So, this is the capitate, the largest carpal bone. This is hamate, and this important bony landmark is hook of the hamate. Then this one triquetral, this is pisiform, lunate, scaphoid, then trapezium, then it is trapezoid. And if I see from the dorsal aspect, these are all carpal bones. This is capitate, this is hamate, triquetral, lunate, scaphoid, trapezium, trapezoid, and this one is pisiform. Pisiform is well identified from the palmar side. This is pisiform. This is one of the example of sesamoid bone. It develops under flexor carpi ulnaris. So, there are 8 carpal bones. In the proximal row there are 4 and distal row 4. The proximal row is scaphoid, lunate, triquetral and pisiform, and distal row trapezium, trapezoid, capitate and hamate. In the examination, you may face some questions from the bones of the hand, and these questions may be asked in the oral and practical examination, and also may be asked in the theory question. So, let us discuss one by one. First of all, the question is, how many bones are there in an articulated hand? The answer is very simple. There are 8 carpal bones, 5 metacarpals and 14 phalanges, together 27. Enumerate proximal and distal rows of carpal bones. I already told you, just a repetition of this answer. In the proximal row there are 4 bones from lateral to medial. These are scaphoid, lunate, triquetral and pisiform. And in the distal row also there are 4 bones from lateral to medial: trapezium, trapezoid, capitate and hamate. Next question may be asked, that is, what type of bone are the carpal bones? The answer is, all the carpal bones are short bones. Next question is, what type of bone is the pisiform? Pisiform is the sesamoid bone. You know, the sesamoid bone is a bone which is devoid of periosteum, no Haversian system, and it develops under a tendon. This pisiform bone, it develops under the tendon of flexor carpi ulnaris. It is the only sesamoid bone in the hand. Next question. The question is, which one is the smallest carpal bone? Again the answer is simple. It is again the pisiform bone. Next question. Which one is the largest carpal bone? And it is the capitate. Capitate means head of the all carpal bones. It is the largest one. Next question. Most commonly involved carpal bone in fracture. And the answer is, it is the scaphoid again. And in this picture you can see the yellow circle. It indicates the fracture site of the scaphoid. Next question. Which carpal bone is commonly dislocated? The answer is lunate bone. And the nerve involved in lunate dislocation is the median nerve, as it lies in front of the lunate bone. Next question is, what type of joint is the first carpo-metacarpal joint? This is first carpo-metacarpal joint found between the trapezium and the base of the first metacarpal bone. So, this joint is very important in the hand. It may be asked in the theory as well as in the practical examination. So, you must remember and must go through this joint, and this is Sunnyvale joint and subtype biaxial saddle joint. Next question is, what are the movements that can take place in this joint? There are so many movements can take place. These are flexion, extension, abduction, adduction, circumduction, which means the sequential movements of all the above four movements, and also the last one is the opposition movement. Next question is, first carpal bone to ossify. The first carpal bone to ossify is the capitate. It appears about 2 months after birth. Next question again, last carpal bone to ossify. It is the smallest bone, pisiform, which appears about 9 to 12 years after birth. Next question, what types of bones are the metacarpals and phalanges? All the metacarpals and phalanges, they are short long bones or miniature long bone. In these bones, only one epiphysis at one end, either at the head or at the base. So, in the phalanges and in the first metacarpal, the epiphysis is at the base, and all other four metacarpals, their epiphysis is at the head. On the basis of this ossification, there may be another question, and that question is, first metacarpal bone may be considered as a modified phalanx. The reason is that the reason lies in the position of the epiphysis. In the red circle, you can see the first metacarpal base. Here you will find the epiphysis, and in the phalanges, there also at the base they are the epiphysis. So, epiphysis of all phalanges, including the first metacarpal, lies at their bases. So, because of this reason, it is the phalanges which is similar to the first metacarpal bone on the basis of their position of epiphysis. For this reason, the first metacarpal bone also considered as the modified phalanx. Please click on the like button and of course subscribe it and share to your friends. Thank you.